Assuming a heart rate of 72 beats per minute, each cardiac cycle lasts 0.8 seconds. This duration consists of 0.3 seconds for ventricular systole and 0.5 seconds for ventricular diastole. The S1 heart sound marks the closure of the atrioventricular valves. This includes the mitral and tricuspid valves. Immediately after S1, the ventricles begin to contract while all valves remain closed. This phase is known as isovolumetric contraction. Opening of the aortic and pulmonary valves produces clicks. Following these clicks, blood in the ventricles is rapidly ejected. The S2 heart sound indicates the closure of the aortic and pulmonary valves. This event marks the beginning of ventricular relaxation. Isovolumetric relaxation occurs while the atrioventricular valves are still closed. Opening of these valves eventually produces diastolic sounds called snaps. Rapid filling of the ventricles follows the opening of the AV valves, producing the S3 sound. Pressure differences between the atria and ventricles drive this flow. Diastasis represents the phase where blood flow between the atria and ventricles is at its minimum. Pressure differences are significantly reduced during this time. The atrial contraction, or atrial kick, pumps additional blood and produces the S4 sound. The cycle then repeats starting back at S1. The JVPA wave coincides with atrial contraction and precedes the S1 sound. It reflects the increase in right atrial pressure. The C wave is due to tricuspid valve bulging and coincides with the carotid upstroke. The X descent follows S1 and represents atrial relaxation. The V wave represents atrial filling during ventricular systole and precedes S2. The Y descent occurs during right atrial emptying and ventricular diastole. Atrial contraction follows the P wave of the ECG isovolumetric contraction, and systole follow the QRS complex. In the left ventricle, peak systolic pressure reaches 130 millimeters of mercury. The end diastolic pressure is 10 millimeters of mercury. Right ventricular peak systolic pressure is 30 millimeters of mercury. The end diastolic pressure stands at 6 millimeters of mercury. Aortic mean pressure is 95 millimeters of mercury. Peak systolic pressure is 130 and end diastolic pressure is 80 millimeters of mercury. Early systolic murmurs involve regurgitant lesions of the mitral and tricuspid valves. Mid-systolic murmurs often indicate stenotic lesions of the aortic and pulmonary valves. Ischemic cardiac pain is typically central, diffuse, and squeezing in character. It is often provoked by exertion or emotion. Non-cardiac pain is usually peripheral and sharp or stabbing. It is often spontaneous and not related to physical exertion.